it's Dr. Diaz. This video is meant to go over post-op instructions for your pet's, your dog or your cat's neuter. So your pet has been neutered. There is a prescrotal incision for dogs. So one small incision kind of in the prescrotal area. For cats, there are two incisions, one over each testicle. For the dogs, there will be some stitches in there. Typically the incision is quite small, and so the stitches may or may not poke out a little bit. This is not to be this is nothing to be worried about or concerned about. For cats, you shouldn't see any stitches peeking through or anything like that. With the incisions, sometimes they can become a little itchy and may want to groom or chew at the incision sites. It is really important to keep a cone on your pet during the recovery period. So your dog or cat will go home with a cone on. It is a softer cone, and typically they tolerate these well, but those should be left on for at least a minimum of 1 week. This will keep your pet from wanting to lick or chew at their incision site. If they are messing with the area, licking, grooming, there is an increased risk of dehiscence, so the incision site pulling apart, opening up, or infection that may lead to other complications. So keeping the e-collar on is really important. During the same period of time, they really should be taking it easy at home. So they should not be allowed to run around, play. They should not be very active, no jumping, zoomies, going to the park or anything like that. So your pet should be resting, relaxing indoors. Dogs can definitely go outside to use the bathroom on their leash, preferably even if there is a yard that they have access to, and this is just to keep them from running off after a squirrel or something like that. If they are too active, there's an increased risk, like I said, of dehiscence, but dogs can also get what's called a scrotal hematoma, where that empty scrotum fills with blood. This can take months and months to fully heal, and it can lead to other complications, and in some cases may even require a second surgery. So it'll be very important that you keep the cone on and you keep your pet from being too active. To help with that, we can provide post-op sedatives, and this is typically recommended. So dogs, they normally get trazodone, which can help be quite a little bit of a sedative. So at lower doses, it can just help them relax. Some dogs do need higher doses, and the instructions on how to titrate this dose is on the label for you to review. For cats, they go home with gabapentin, which can help a little bit with pain, but it is a bit of a sedative as well, and it'll help keep your cat a little bit more calm and keep them from wanting to play too much. Both cats and dogs go home with an NSAID to help with pain and inflammation. Dogs typically go home with either carprofen or meloxicam. Cats will go home with some meloxicam. Instructions are on the label, when to give, how much, and how often. If you have any questions on that, definitely let us know. If you elected to have a microchip placed for your pet, we do that during anesthesia, and we will send home the information associated with your microchip. That will all be registered to you, and your information will be associated with that number. Things to be on the lookout for are excessive inflammation, bleeding at the incision sites, any discharge, any abnormal odors. These are all signs that there could be an infection or something else going on. Appetite might be reduced throughout the night after the procedure. So if your pet does not want to eat dinner, that can be pretty normal and not something to worry too much about. However, if you do offer food the next day and they're still not eating, definitely let us know right away. You are welcome to offer their normal dinner later on in the evening. Your pet should have received a Cerenia injection or an oral anti-nausea medication the night before. This medication is on board for about 24 hours, and that helps reduce some of that kind of nausea-inducing effect of anesthesia. So just be aware that the night of the procedure, your pet may not be very hungry, and that's not something to worry too much about, but definitely let me know if they're not eating the next day. Other than that, these guys typically recover fairly quickly, but if you do have any concerns, definitely give us a call, let us know, and we can talk through it. That's pretty much all I have for you now. Bye.